Morning. See, with those beautiful pictures, I am taking you to those slides which just have lines, And Honorable Ambassador, you raised the profile of the event by being here and speaking. And I think you shed light on things that probably we won't speak. It is inspiring to hear you. So when I'm speaking on e-health in India, I think if you looked at this presentation, this will walk you through the entire history of how e-health has evolved in this country. Then probably I'll share something on what the vision of the government is and what are things in the making for e-health. So we started our journey in e-health some 20 years ago. It came with the first deployment by CDAC, which is a kind of a Kasi government body, with deployment of hospital information systems in Sanjay Gandhi Institute. Then we had the indigenous development of telemedicine and technology deployment by DITI at AIIMS, at SGPGI and PGI Chandigarh. 2000, ISRO stepped in with the satellite telemedicine center. And 2001, the first telemedicine network started between AIIMS, PGI and SGPGI. So 2003-04 deployment of SATCOM based TM nodes started across the country by ISRO. Then there was we are known for task forces. Any government is known for committees and task forces. So 10 years ago, we had a task force. I don't see Bedi here, but I saw his name. Maybe it's in the evening forum where I am chairing a session. I don't know where the report of the task force is. Nothing happened for last 10 years in telemedicine. So when I met the health minister in January, I said, if you form committees and task force, I'll be the first one to criticize you. No committees, no task force. I mean, we hate that. You have so many reports that come, you don't act on it. Then for the first time in 2006, Planning Commission approved budget for e-health. 2006, the 11th five-year plan, the School of Telemedicine and Biomedical Informatics was set up in the Sanjay Gandhi Postgraduate Institute in Lucknow. Then again, we had Healthy India website being asked to PHFI to set up. Then the STBI at Sanjay Gandhi was made the National Resource Centers by DITI, not by Ministry of Health, which came in later. So 2007, Ministry of Health supported teleophthalmology. Then they supported OncoNet project for cancer. Then we have the National Rural Telemedicine Network to start pilot projects. Pilot again is a challenge and we still continue to do pilots. National Medical College Network. I mean, this is interesting. 2010 we conceive a project and 2013 we implement it. So it takes 3 years time from ideating it and implementing, the big challenge. If we're talking of technology. So 2010, Sanjay Gandhi Postgraduate Institute was made National Resource Center for Telemedicine. Then Mother and Child Tracking System was launched by Ministry of Health and Family Welfare, which is one of the successful projects in the country. Luckily, on the standards that you talk about, I think government is pretty serious about it. So in 2012, we had the electronic medical records and electronic health record standards. So the government is working on the standards. I see a couple of friends here. We work on the m2m standards committee, which has been driven by the Technology and Engineering Center. So standards something country is very serious about. Knowing that we don't have 1.3 million, or 1.3 billion, we will have probably thousands of solutions addressing those large segment of the population. It will not be one company, it will be hundreds of them. If they are not interoperable, if they are not standardized, we are playing with the lives of people. So I think standardization becomes very critical to India's healthcare system. So the Ministry of Communication IT has the National Optical Fiber Network that you probably spoke about, is to provide high-speed bandwidth to every village, every Gram Panchayat rather to say. Then the ministry realized, that we don't have in India something like WebMD, so people get lost for information, So November, our health minister launched this National Health Portal. So this is a source of credible information on health that you can log on to see. Of course, it's a beta version. Then we have the National Knowledge Network, which is like state-of-the-art multi-gigabit pan-India network, which is trying to connect all knowledge institutions across the country. Health has benefited. We have close to 151 medical institutions connected. I mean, the government's vision is let's first connect the medical colleges, let's link them to Panchayat, primary health centers, and then provide telemedicine and e-health. Then we have the statewide area network, which is to enable states to have bandwidth connectivity of 2 to 10 Mbps. Again, we have 3 pilots going on to test telemedicine. So we have 3 blocks covering 58 Gram Panchayats in 3 states. One is in Aryan block, Ajmer, Rajasthan, other is Vizag, and then we have in Tripura. So each of these block centers are connected to a hospital, medical college. So then we have the regional resource centers. See, India is a big country, it's like if you divide the 4-5 zones. So what we have done is put up regional resource centers. So one nodal center serves couple of states. So the Lucknow center serves UP, Bihar, Jharkhand, and each of these are like 50 million population or more, each of the states. Then the Chandigarh stands for JNK, Jammu and Kashmir, Punjab, Chandigarh, Haryana, Himachal Pradesh. Then you have KM Hospital in Mumbai, which serves as regional resource center for Maharashtra, Gujarat, Goa, Daman, Diu, and Dadra and Nagar Haveli. AIMS Delhi is the regional resource center for Uttarakhand, Delhi, MP, Chhattisgarh, Rajasthan. Jipmar Pondicherry is for AP, Tamil Nadu, Karnataka, Kerala, and Pondicherry. The NIGRIMS is regional resource center for northeastern states, the 7 states in the northeast. Gujarat, Maharashtra, Odisha, and Uttarakhand, they've started using PPPs. I mean, that's the model where probably you will see every state of this country getting to, because one of the challenges I see in the ministry is technically we have solutions for every problem you have, whether it's chronic diseases, rural health, talk of anything, or education. But organizational maturity is missing. I mean, one of the reasons I figured out why they are not implementing despite funding is the guys don't know technology. I mean, they are bureaucrats. So, well, they have funds, they don't know how to use it, and they're probably too shy to ask someone like, what do we do? I mean, I had a senior official asking me, how do we set up a telemedicine center, what it takes to do it? I mean, once he was told, last year probably we used some funds to deploy, and this year we're asking for some, I think, 200 times more money. Now, how will justify the finance ministry is a tough call. So 108 is an emergency ambulance service which has been really successful. What they have done is they have cut down the response time to 22 minutes in rural areas and 15 minutes response time in urban areas. So from the point you make a call, the ambulance will reach the person in 15 minutes in urban area, which is a big success story. So teleradiology, teleophthalmology, so mother and child tracking system, and emergency response service are success stories in e-health. We need to replicate them in other segments of healthcare. The Ministry of External Affairs put up 2 projects. One is the Pan-African E-Network, which connects almost like 54 countries through telemedicine, and then the SARC, which is South Asia Regional Cooperation Network for Telemedicine. Then there are about 35 projects funded by international financial institutions like World Bank, Bill and Melinda Gates Foundation, and USAID and World Bank. There are more than 40 private sector projects in this area. So one of the key things if you see is ophthalmology. If you take one of the biggest hospitals in the world, probably if I were to say, the Arvind Eye Care System, Shankar Netralaya, how they operate is like they do 700 to 800 consultations per day. And this is all done by telemedicine. So a person would walk into the nodal centers, a technician is there, he will evaluate them and then say, okay, there is a consultation I am doing with the doctor. Then they recommend, should you go to the main hospital or not? So these are the success stories. I mean, if you take out telemedicine from ophthalmology, these hospitals will collapse the same day. This is one of the big success stories we have. What next? Which is important. So luckily we have a Prime Minister who believes the best way to divide, and to remove the divide is empower them. And one thing that he has said is, I want digital cloud for every Indian, electronic health record for every Indian. Let's use digital. Let's digitally empower every household. Health also becomes core to it. So an era of action. So first thing is that this probably could be something that you don't know as of now. I don't know how many have heard about the India Health Information Network. So December I had a discussion with the Joint Secretary in Manila. I was a part of the ADB meeting and I said, why don't we set up a India Health Information Network? There are like groups like you who work in Health Information Network. Why don't we get people and organizations a part of a formal network put up by the government where they can exchange ideas, look at collaborations representing globally. So 6 December and 6 January the government passed an order setting up IHIN, which is in 30 days, which will be hosted by FICCI but funded by the government of India. So this is something that we are seeing that's happening. Then other thing was, see what had happened so far. We had task force, we had committees, we had programs, but these are ad hoc. So this is an officer who is very pro and passionate, the program works. The moment he or she is transferred, the program dies. So one of the things that I took a call on was to set up an institutional body. So the National E-Health Authority will be set by an Act of Parliament as a constitutional body to look at e-health, which will look at standards, frameworks and deployments. So this is already in the works, and I'm hoping that if not this year, early next year it will come by an Act of Parliament. So that's the time you can see mass or scale deployments of e-health in the country. So as I said, many of us friends are sitting here. We work in the Telecom Engineering Center in the under Ministry of IT on the m2m standards. So we are already almost, I would say 60% of the work is done. The process is, once we get through this, we go to the next stage, that is the Bureau of Indian Standards, which notifies for the country the standards. So we are fairly, going good on the standards part for health and other sectors as well. All of us cannot be sitting and discussing it in just forums. The national health policy is likely to be announced soon. The work is done. The draft is already on the website. So if any one of you has inputs, we have timelines till 20th of February to give inputs. You should do that. Then in the next couple of weeks, you will have the draft of the National E-Health Authority also on the ministry website. So would encourage you all to give inputs on that as well, because if you really want to see things coming out of these discussions taking concrete shapes in terms of government programs, you need to be actively participating. It can't be just left to the bureaucrats to play around with the policies. Then the ministry had asked PCHA and HIMSS to host a joint summit on e-health, which dates are not yet decided, but I think you can contact on this email ID to check what's going on. So that is something that ministry wants to do, to engage with the entire stakeholder community of how they want to take e-health in the country. And last two slides, I'll talk about the evidence that is mounting. One of the things that e-health has not taken off anywhere in the world, I'll say very safely, is this lack of evidence. You cannot expect doctor to play with the life of a patient without evidence. I mean, we blame doctors, that they are slow adopters of technology. It's not a fact. In fact, most of the technologies are adopted by doctors the moment they have clinical evidence. Whether it is stents, whether it's any of the transplants, these are all technology driven. They adopt it, or MRIs or CT scans. E-health somehow has not been able to, through evidence, that convinces the doctor to say, okay patient, why don't we do an e-consult? The last part is 90% of the patient, more than 90, believe that it was somewhat very satisfying for them to use technology. So I don't see a reason why we should be holding on deploying e-health in the country. And this comes from nothing else than Mayo Clinic. Mayo Clinic is someone, everyone records in the world. And this is a Mayo Clinic study on e-health. So I think given all this, we shouldn't be far away. I mean, I'm quoting this article that came in Economic Times that I authored in December. Software came as a product. It became a service. Now software is a drug. In the US, now software has been given a drug code. My friend's company, which is WellDoc. So a doctor can prescribe his WellDoc app, and this is reimbursed as a drug in the United States. So 10th of this month, I was in DC, and I was meeting with my friend who heads the US FDA, Bakul Patel. He's Indian, and he heads mHealth and he said, Rajendra, I am willing to work with India and to figure out what we can do in India. And he also chairs the global group called MDRF, the Medical Device Regulators Forum. So I think the time has come when we start using these technologies. E-health and mHealth as a subset of it is more important, because in India, you see 970 million mobile subscribers. I mean, there's no bigger platform in the world than mHealth for healthcare. So I think this is the way it's going to be. And lastly, it has made it to the cover page of Time. So, Time is not a magazine that will put anything and everything on the cover page. So there we are. I think the Time is good for us. Thank you so much.